Hello and welcome. Today we're diving into the world of biliary diseases, specifically focusing on cholangitis. Cholangitis is an infection of the bile ducts, the tubes that carry bile from your liver to your gallbladder and small intestine. Understanding this condition is crucial for prompt diagnosis and effective management. So, let's explore what causes it, how it develops, its symptoms, and the best ways to treat and prevent it. Now, let's talk about what causes cholangitis. The most common culprit is a blockage in the bile duct. This blockage can be caused by gallstones, which are hardened deposits that form in the gallbladder. Other causes include bile duct strictures, which are narrowings of the bile ducts, tumors in the bile duct or pancreas, and even parasitic infections. In rare cases, cholangitis can occur after medical procedures, such as ERCP, if bacteria are introduced into the bile ducts during the procedure. To understand cholangitis, we need to understand the pathophysiology. When a bile duct is blocked, bile, which is normally sterile, can become stagnant. This stagnant bile provides a breeding ground for bacteria. These bacteria multiply and cause inflammation and infection within the bile ducts. The increased pressure from the blockage and the inflammation can then lead to damage to the liver and even systemic spread of the infection if left untreated. Cholangitis isn't the most common disease, but it's important to be aware of. The exact prevalence is difficult to pinpoint as many cases are associated with underlying conditions like gallstones. The risk of developing cholangitis increases with age, and it's more common in individuals with pre-existing biliary conditions. Individuals who have undergone biliary procedures, like ERCP, may also have a slightly elevated risk. Recognizing the signs and symptoms of cholangitis is essential for early intervention. The classic triad of symptoms, often referred to as Charcot's triad, includes right upper quadrant abdominal pain, fever with chills, and jaundice, a yellowing of the skin and eyes. A more severe form of cholangitis, known as Raynaud's pentad, includes Charcot's triad plus altered mental status and shock. Other symptoms may include nausea, vomiting, and dark urine. If you experience any of these symptoms, it's crucial to seek medical attention immediately. Diagnosing cholangitis involves a combination of physical examination, blood tests, and imaging studies. Blood tests will help detect elevated white blood cell counts, indicating an infection, as well as elevated liver enzymes and bilirubin levels, suggesting liver damage and bile duct obstruction. Imaging studies, such as ultrasound, CT scans, or MRI scans, are used to visualize the bile ducts and identify any blockages or abnormalities. ERCP, endoscopic retrograde cholangiopancreatography, can also be used for both diagnosis and treatment, allowing direct visualization of the bile ducts and removal of any stones or strictures. While there aren't distinct types of cholangitis in terms of etiology, it's often classified based on the severity of symptoms and the presence of complications. Acute cholangitis refers to a sudden onset of symptoms, while chronic cholangitis involves ongoing or recurrent inflammation of the bile ducts. Additionally, cholangitis can be classified as mild, moderate, or severe based on the presence of organ dysfunction and the need for intensive care. Treatment for cholangitis focuses on relieving the blockage, controlling the infection, and preventing complications. The first step is usually antibiotic therapy to combat the bacterial infection. Fluid resuscitation and supportive care are also important. The definitive treatment involves removing the blockage, which can be achieved through ERCP, surgical intervention, or percutaneous drainage. ERCP allows for the removal of gallstones or placement of stents to open up strictures. In severe cases, surgical removal of the gallbladder or bile duct may be necessary. Preventing cholangitis largely depends on managing the underlying causes, such as gallstones. Maintaining a healthy weight, eating a balanced diet, and avoiding rapid weight loss can help prevent the formation of gallstones. If you have gallstones, your doctor may recommend medication to dissolve them or surgical removal of the gallbladder. In patients who have undergone biliary procedures, adhering to post-procedure instructions and reporting any signs of infection promptly is crucial. The prognosis for cholangitis depends on the severity of the infection, the presence of complications, and the timeliness of treatment. With prompt diagnosis and appropriate treatment, most patients recover fully. However, if left untreated, cholangitis can lead to serious complications, such as liver abscesses, sepsis, and even death. Recent research focuses on improving diagnostic techniques, developing less invasive treatment options, and identifying new antibiotic therapies to combat resistant bacteria. Further studies are also underway to understand the underlying mechanisms of bile duct inflammation and identify potential targets for future therapies.